Hello, my name's Mike and this is a video about personal independence payment, daily living activity number 2, taking nutrition. This part of the assessment is about the help you need most days to cut up food, transfer food and drink to your mouth, chew food and swallow food and drink. It's about the help you need to do that safely in a reasonable time, whenever you need to in the day, and to do it without too much pain, discomfort or other bad effects. Now, the first thing to note there is the very restricted nature of what they're going to look at. Cutting up your food, transferring it to your mouth, chewing it and swallowing it. I very often see PIP forms where people have mentioned how someone's diet is not a good one. It might be repetitive, it might be restricted. Well, clearly that's an important point for that person, but it's completely irrelevant to PIP. Cut up your food, get food and drink to your mouth, chew your food, swallow it. That's all they're interested in. So, what do we need to tell them about? Well, of course, I've got a checklist. I've always got a checklist. A list of all possible PIP questions, or so I reckon. And the first question for this activity is about AIDS. The first question is always about AIDS. So, what things do you use to eat that you wouldn't need to use if you didn't have your health condition or disability? If you do need to use an object, a thing to eat if you need AIDS, you will score 2 PIP points. The second question is about prompting, whether someone needs to prompt or remind or encourage you or explain things to you in order for you to take nutrition. If that's the case, you'll score 4 PIP points. The third question is about needing physical help. Well, what you score if you do need physical help depends upon what sort of help. If you need someone to cut up your food for you, you score 2 points. If you need someone to take food and transfer it to your mouth, you score 8 points. Next to last question, it's about safety. Do you need someone with you all the time you're eating and drinking to keep you safe? And the final question, is it true that say you've got your AIDS, you've got your physical help, you've got your prompting, reminding, encouraging, explaining, you've got someone with you all the time you're eating to keep you safe. Say you've got all that in place, is it true that you still can't eat safely, that you still can't eat in a reasonable time? So those are the questions. So here's some examples. These are things that I've written with people that I've supported filling in their PIP forms or dealing with the PIP process. The first example is a young man I worked with who had a brain difficulty which had caused him to have a tremor. We needed to tell the Department for Work and Pensions about AIDS. What things do you use to eat that you wouldn't need to use if you didn't have your condition or disability? And what he said was, because of my tremor, nowadays I always use a cup with a lid and spout or a lid and straw. Simple as that, 2 points. If you've seen the earlier video about preparing food, you'll be familiar with Miriam and her situation. When we were looking at what she needed to tell the decision maker about, she answered the questions about physical help. The question was, would you usually need another person to cut up your food or to help you get food and drink to your mouth? And Miriam wrote, because of the pain and weakness in my hands and wrists, Lemmy always cuts my food into bite-sized pieces. Physical help, cutting up food, 2 points. So I worked with a gentleman whose partner, when she was in her early 60s, began to show significant signs of dementia. Now she is very severely affected by it. The first thing we wanted to tell the decision maker about was about prompting. So we answered the question, do you need someone to prompt you, remind you, encourage you, explain things to you? As follows. Since her dementia started, Sarah forgets to eat and has no appetite. She can get food into her mouth and chew and swallow it, but she will not do so unless someone sits with her, prompting and encouraging her. However, the thing about Sarah is that she eats very slowly. And so we also answered the question, about the length of time it takes? Is it true that even with all the help you've described above, that's the prompting, reminding, encouraging, is it true that even with all the help you've described above, you still can't eat safely? Well, you can. Still can't eat in a reasonable time? No. So this is what we wrote. Even with lots of encouragement, Sarah takes ages to eat anything. It can take an hour just to eat a small 200-gram tin of beans and a single slice of toast. And because we've explained that even with prompting, reminding, encouragement, Sarah can't eat in a reasonable time, taking no more than twice as long as she used to, well then, she scores maximum 8 points. If you need to explain yourself to a decision maker, your initial claim, a mandatory reconsideration, or maybe you need to communicate with a tribunal, well, maybe you'll find my checklist helpful. I'm sorry I can't help with individual claims, but if your organisation needs some training, please get in touch.